The Mayo Clinic has announced a new treatment that could improve survival rates in older patients with glioblastoma, a particularly lethal form of brain cancer. Dr. Sujay Vora is a radiation oncologist with Arizona Mayo Clinic. He joins us now. Welcome to Arizona Horizon.
Oh, thank you for having me.
Let's do the basics here. Glioblastoma. Give me a definition.
So glioblastoma is a type of primary brain cancer that originates in the brain tissue itself as compared to metastatic cancer that spreads to the brain. This type of cancer is quite insidious. It affects about 15,000 patients a year. And the incidence is actually increasing as our patient population continues to age.
Why is it so lethal? Why is it so aggressive?
A couple of things. One is detection. We don't have any screening methods for finding glioblastoma, so it's usually when patients actually present for medical attention because of either a seizure, weakness, behavioral changes, where we actually first find this. Then the next challenge is operating on these patients.
Yes.
Where these tumors tend to have these tentacles into healthy brain tissue, which makes a complete resection quite difficult.
It's almost like a spider web. Is that kind of how it works?
Mm-hmm.
And that's
yeah,
why it
absolutely.
makes it so difficult to treat?
It is. It's different than, say, breast cancer, where you can do a mastectomy or a large lumpectomy to get around the cancer. For the brain, the surgeons really have to take out as much as they can safely without leaving the patient worse off.
All right, that's where Mayo Clinic, this phase 2 of this study comes in on this new treatment.
Yeah.
What's this all about?
So after surgery, we see patients back and we discuss a course of radiation and chemotherapy. That's considered standard of care. So these are 6 weeks courses of treatment that we give with chemotherapy. And what we found, particularly in older patients, is that they tend not to live very long, many times because of other medical conditions that they have. So the average survival rate for patients over the age of 65 to 70 is probably in the 6 to 9 month range. Mm-hmm. So we really tried to come up with a more novel way of trying to treat these patients, combining a few different techniques. One is we wanted to see if we could see the cancer better. So we were using some advanced medical imaging called a PET scan. We're using some advanced forms of radiation delivery called proton beam therapy that allows us to shield more of the healthy brain tissue to reduce the side effects for each patient. And then we're trying to reduce the burden for patients and their families and trying to finish the radiation much faster over just 1 to 2 weeks. And this combination approach really showed results that were better than what was expected.
So basically you identify what's going on in there as best you can with these spider webs, sometimes difficult to find. Right. And then this proton beam, what do? You just focus on one part of it that you know you can get?
So proton beam therapy uses a heavier particle to deliver the radiation. The closest analogy is sort of like a smart bomb. We dial up the energy, it goes a certain distance into the brain tissue, it drops its radiation into the target, and then there's basically no radiation after that. That's compared to standard radiation that uses X-rays that go through and through the brain tissue. So there's much less brain exposure, which I think is important for all patients, but particularly for older patients that have this disease.
I was going to say, you mentioned radiation treatment. That basically was what was done prior to this. And still is done, true?
Right, and this is still radiation. It's just a different type of radiation that allows us to shield much more of the healthy brain tissue compared to standard techniques.
Kind of a sniper as opposed to an elephant gun.
That's right.
It's called a short course therapy. What does that mean?
So the standard courses of radiation are generally between 3 and 6 weeks. So what we decided to do in the short course approach is actually finish the radiation in just 1 to 2 weeks. Again, much more convenient for patients and families. We also had patients from rural areas that were able to come and access health care with much less burden to both the patient and their families.
Is there a limit? Let's say there's just say 5 tentacles, just for argument's sake here. You got one. Can you go after 2, 3, 4, and 5? Is there a limit to how much you can do?
We try to treat all the disease at the same time. So every place where we think that there's cancer, we want to cover that comprehensively. We do run into situations, unfortunately, these cancers do have this inclination to come back despite our best treatments. So there are times where we sometimes have to come back a second time, either with radiation, surgery, or sometimes some novel types of chemotherapies.
But increasing the survival rate by like 22 months or so, that's pretty impressive. What is it prior to this? What was it, like less than a year, as you mentioned?
So this study really focused on older patients. So the average survival in older patients typically is somewhere between 6 and 9 months. So the average survival in our patients were 13 months, And then there is a population of those patients that have had more favorable genetics that actually lived out to close to 2 years.
Wow.
So we really feel like we're moving the needle. We're not done yet, but I think we're encouraged by these initial results.
And that allows for quality of life. I mean,
right.
this allows people to do things. I mean, response so far? I mean, it obviously sounds like a success. What's next as far as the studying and the testing is concerned?
So with these favorable results, and we're now actually asking the question, is this actually a good idea for all patients with glioblastoma? So we're actually opening it up to patients of all ages. And we're also trying to test to see how much are we actually benefiting with proton beam therapy. So we're actually allowing both standard radiation and proton beam therapy for this group of patients. So we're actually going to learn a lot more. It's a much bigger study. It's about 4 times larger.
Wow, wow. Well, continued success on this, and best of luck, Dr. Sujay Vora. Again, this is glioblastoma. Of course, we know from Senator John McCain. This is what he had, and it sounds like it's a good thing.
It's progress.
Yes. Thanks so much for joining.
Great. Thank you so much.